How do bacteria cause UTIs in children? Imagine tiny bacteria that normally live in our intestines trying to find a new place to settle. Sometimes, these bacteria, especially a type called Escherichia coli, move from the bowel to the urinary tract. This is how urinary tract infections in children can start. The urinary tract includes the kidneys, the tubes that connect the kidneys to the bladder itself, and the tube that carries urine out of the body. When bacteria get into any part of this system, they can cause an infection. In children, especially girls, the shorter length of the urethra makes it easier for bacteria to travel upward into the bladder. The bacteria have special hair-like structures called fimbriae that help them stick tightly to the lining of the urinary tract. This sticking is important because urine normally flows out and helps wash bacteria away. But when bacteria cling tightly, they can resist being flushed out by urine. Once attached, bacteria begin to multiply and invade the lining of the bladder. This invasion causes inflammation, which leads to symptoms like pain, burning, and the urge to urinate often. Some types of bacteria, especially Escherichia coli, can even hide inside bladder cells by forming small communities called intracellular bacterial communities. These hideouts protect the bacteria from the immune system and antibiotics, making infections harder to clear and sometimes causing repeated UTIs. Several factors can increase the chance of a child developing a urinary tract infection. For example, anatomical abnormalities in the urinary system can block normal urine flow. Constipation can press on the bladder, preventing it from emptying completely and giving bacteria more time to grow. Poor bathroom habits, like infrequent urination or improper wiping, can also introduce bacteria into the urinary opening. Sometimes, bacteria from the skin or around the urethra colonize the area, especially if the normal bacterial balance is disturbed, such as after taking antibiotics. Another risk factor is vesicoureteral reflux, a condition where urine flows backward from the bladder into the kidneys, which can carry bacteria and cause infections there. In summary, bacteria cause UTIs in children by traveling from the bowel to the urinary tract, attaching firmly to the lining, and multiplying in an environment where urine flow and immune defenses are not enough to stop them. Understanding this process helps doctors find better ways to prevent and treat these infections. If a child shows signs of a UTI, it is important to see a healthcare professional for proper diagnosis and care.